Hello again. You may be wondering, does training on the Basic Emergency Care course or BEC actually make a difference? Well, the literature tells us that the quality of emergency care delivered in limited resource settings may be compromised by lack of early recognition of serious illness or injury, failure to provide initial resuscitation for emergency conditions, and delayed referral to advanced care. This can result in an increase in the number of avoidable deaths and disabilities. Emergency care training designed for low-resource settings, such as the BEC course, improves provider knowledge and skills, facilitates more efficient use of existing resources, and reduces morbidity and mortality by ensuring timely access to quality emergency care. We know that as part of a small bundle of low-cost interventions, BEC is associated with very significant mortality reduction in low-resource settings. The BEC course was intentionally designed to ensure first contact healthcare providers such as doctors, nurses, and paramedics had time for hands-on practice and working through practical clinical scenarios in addition to didactic knowledge delivery. It was piloted in Uganda, Tanzania, and Zambia, emphasizing use of equipment that is commonly available in these settings, which ensured that the course was relevant and practical for low and middle income countries. Now let's hear more from some of the pioneers of the BEC course.
My name is Dr. Joseph Kalanzi and I'm an emergency physician working in Uganda. I would like to share with you my country's experience with the BEC course. Uganda has one of the highest incidences of road traffic crashes in Africa. When I worked at a community hospital here in Uganda in 2010, people would come in with internal injuries and the best we could do was start intravenous fluids and bandage their wounds. We didn't have a structured approach to the management of very ill or injured patients. This is what made me interested in pursuing more emergency knowledge and skills. I was part of the team that supported the WHO pilot of the Basic Emergency Care course. This was supported by a few other simple emergency care tools in a number of facilities in Uganda. The success of this far surpassed our expectations. Mortality related to emergency conditions was nearly halved. Halima Adam is one of the nurses who was trained in the pilot of the BEC course and has since become a master trainer of the course and a champion of emergency care in Uganda.
I remember one emergency case that I managed like it happened yesterday. A young boy was brought into the hospital by his mother, unconscious and barely breathing. The mother told me that he had drank paraffin after mistaking it for a soft drink. Paraffin ingestion is very common in Uganda. Paraffin can cause serious damage to the stomach lining and also cause inflammation to the lungs, preventing the lungs from providing oxygen to vital organs in the body. After completing the BCE course, I had the knowledge and skills to respond in a structured manner and provide life-saving assistance to the boy. I placed an oropharyngeal airway and gave him oxygen. 2 hours later, he regained consciousness. He was the first person I helped after being trained in the Basic Emergency Care course. I'm now teaching others to do the same.
If you'd like to learn more about how you can get involved, please send an email to the address provided or visit the link below.